Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 12. In this video, we're going to cover two coding clinics, and the first one is intestinal microbial overgrowth and the second one is disorders of retroperitoneum. So let's get started with the first one, intestinal microbial overgrowth. And the update here is subcategory K63.82 intestinal microbial overgrowth has been created to capture distinct types of intestinal microbial overgrowth diseases. The new codes are as follows. K63.8211 for small intestinal bacterial overgrowth hydrogen subtype, K63.8212 for small intestinal bacterial overgrowth hydrogen sulfide subtype, K63.8219 for small intestinal bacterial overgrowth unspecified, K63.822 for small intestinal fungal overgrowth and K63.829 for intestinal methanogen overgrowth unspecified. Intestinal microbial overgrowth diseases are the result of overpopulation of bacteria, methanogenic archaea or fungi in the intestine that can lead to debilitating symptoms. There are several types of intestinal microbial overgrowth diseases, including small intestinal bacterial overgrowth, SIBO, intestinal methanogen overgrowth, IMO, and small intestinal fungal overgrowth, SIFO. SIBO, that is, small intestinal bacterial overgrowth, occurs when there is an abnormal increase of bacteria in the small intestine, particularly types of bacteria not typically found in the small intestine. SIBO can result from disease or surgery, which can slow the passage of food or waste in the digestive tract, creating a breeding ground of bacteria. Structural problems may require surgery to correct. However, antibiotics are the most common treatment for SIBO. IMO, that is intestinal methanogen overgrowth, is the overgrowth of methane-producing archaea in the intestines. Archaea are a group of microorganisms similar to but evolutionarily different from bacteria. Elevated levels of methane within the intestines can increase bloating, constipation, abdominal discomfort, and diarrhea in some patients. Treatment for IMO includes antibiotics, diet, or a combination of both. SIFO is characterized by the presence of excessive number of fungal organisms in the small intestine associated with gastrointestinal symptoms such as bloating, nausea, and indigestion. The underlying cause of SIFO is unclear. However, small intestinal dysmotility and the use of proton pump inhibitors are potential causes. Now let's move to the next coding clinic, disorders of retroperitoneum. And the update here is category K68, disorders of retroperitoneum, has been expanded and two new codes have been created to identify retroperitoneal fibrosis and non-traumatic retroperitoneal hemorrhage. K68.2 for retroperitoneal fibrosis and K68.3 for retroperitoneal hematoma. Retroperitoneal hematoma or hemorrhage occurs when blood enters the space in the back of the abdomen. It can be a significant bleed that requires identifying the source to determine the treatment. Patients may present with a sudden onset of abdominal pain or fullness, guarding, and hypotension. CT imaging is used to confirm the hemorrhage, the extent of the bleeding, and its cause, which can be variable and require immediate diagnosis and treatment. The use of anticoagulant or antiplatelet therapy is a common cause of spontaneous non-traumatic retroperitoneal hemorrhage. Vascular malformations and carcinomas of the kidneys and adrenal glands and rupture of an abdominal aortic aneurysm may also cause spontaneous retroperitoneal hemorrhage. Other risk factors include strenuous exercise, coughing, coagulation disorders, and invasive procedures on or through the abdominal wall. It is important to be aware of these risk factors and to monitor patients who are at increased risk for retroperitoneal hemorrhage. Retroperitoneal fibrosis is a condition that progresses slowly and involves formation of fibrous tissue and chronic inflammation in the retroperitoneum. Growth of fibrous tissue can result in the compression and blockage of ureters, the inferior vena cava, and other organs and vessels located in the back of the abdomen. Most cases of retroperitoneal fibrosis are idiopathic. Secondary causes are medications, malignancies, infection, radiation therapy, and surgery.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.